Hi, my name is Samantha Davis, and today I'm going to be discussing with you shorter nursing hours. The major problem in the nursing field is that nurses work 12-hour shifts every day, and this can lead to sleep deprivation because with nurses working 12 hours, that means they spend over half their day at the hospital, and then with driving to and from work, that's probably another hour. So they're getting little sleep at night to get up and go to work the next day. And nursing isn't like other careers where they're working with a computer or a car. They have people's lives in their hands every day. And with nurses need to be at their full capability in order to save these lives. Um, the sleep deprivation can result in medical errors that could have been otherwise prevented if the nurse would have been working at their full capability. And in extreme cases, these errors can also lead to death. If a nurse isn't working to their full potential, this can lead to the patient feeling unsafe because they could feel the disconnect between where the nurse should be and where they're actually performing. And long nursing hours can also lead to an increased rate of burnout because when nurses have to work long hours during the day and they're on their feet for so long, it can lead to health problems within the nurse themselves, such as in a minor case, back problems or joint pain, or in a major case, it can lead to heart problems due to the stress of having patients' lives in their hands all day, every day. So, solutions that have been tried in the past are 8-hour nursing shifts, but this was unsuccessful because it required nurses to work 5 days a week. And instead of the 3 they were used to, this was a really big jump from having 4 days off a week to only having 2. And since most nurses are moms, this didn't allow for them to have as much time with their kids and to be as involved as they wanted to be. So there was just a big disconnect there that really didn't work. Also, when nurses only had to work 8-hour shifts a day, that means that patients had to be handed off 3 times throughout the course of one day. And when a patient is handed off from one nurse to the next, information can be miscommunicated, or the patient just couldn't have the same connection with the nurse because they're only spending 8 hours together a day, and then they're having to skip to the next nurse. And when this happens, the patient may not feel comfortable discussing everything with the nurse because they don't have that same bond that they need to. So my proposition is that nurses should work 10-hour shifts 4 days a week. This would mean that nurses would still get almost half of their week off to still get to spend with their families. But I would also recommend that while nurses are at work for the 10 hours, that they have a mandatory 30-minute break or 2 of them, depending on what the hospital wants to do. But this would allow for the nurses to just have some time to cool off in the middle of their shift, to just unwind a little bit, to get their head back into things before going out. Because, like I said, they do have patients' lives in their hands all day, every day. But having them also work 10 hours allows for them to have fewer handoffs than they would if they were working 8-hour shifts, which will allow for that bond that needs to happen between the patients and the nurses. Um, Working the 10-hour shifts will allow nurses to get more sleep at night because they'll get home sooner, and then they can go to bed and get a decent amount of sleep, so they will be prepared for work the next day, so that patients are getting the best care possible. So the components and feasibility. For the feasibility, hospitals will have to make an effort to make the switch, meaning that it won't really require any money to make the switch, but hospitals will have to be willing to adjust their scheduling and make it possible for the nurses to be able to perform at their best possible. Um, if they did make the switch, there would be a major reduction in medical errors because if nurses are working at their best, then they're able to respond to emergencies quicker, and they're making sure that they're reading everything properly so that the wrong medicine isn't administered. And this leads to not only a safer environment for the patients, but it also leads to a safer work environment for the nurses. because if a nurse is working 12 to 14 hours during the day and then they have to drive home afterwards, it can lead to them falling asleep at the wheel, and they could injure someone not only at work but outside of work too. It will also cause a reduction in health problems within the nurse. So if they're on their feet less during the day, then there's going to be less joint and back problems. And if they're dealing with patients less and having more time to unwind before going back to work the next day, then it will reduce the stress also, which will lead to less burnout and more nurses to help in the field. So my call to action is that in order to reduce medical errors made in hospitals, they should switch to 10-hour shifts to help save lives, reduce medical errors, and prevent burnout in the career. These are my references, and thank y'all for listening, and I hope you take this into consideration.